Guys, this is Dr. Bhupesh once again from Dr. BK Mohit Institute, just starting from where I left. And I'm just going to put these two recordings together. So we were noticing that there was a patient known as Brayan Harris, 42 years old, and he was having problems and he was hit by a boat. So I was telling you about noticing articles, which are very important, like word "and." Then I told you about noticing words like "with." So "with" means prepositions. So we were discussing about this thing. Then we were discussing about the prepositions like "on." So that is what I was teaching you, that these words are very, very important. So you have to be careful about those words, because they give you an idea what kind of a blank you are trying to fill in. Then we were discussing about this word cipro. So we were expecting that it should be ciprofloxacin. So there must be some disease which must be having some kind of infection. Then family history of illness. Mother, maternal grandmother had dash. Father had prostate cancer and he is having heart disease and diabetes. So now there is a family history. So now I can make up the story that Brayan Harris is a person who had some kind of grafting. Why grafting was done? Because he was hit by a boat while he was in the water. Then grafting was done. Now he is having hypergranulation. So that is what is the story. So always try to understand the story in the first 30 seconds. Then diagnosis. Cardiology is regular. That means no heart problems. There is no dash. So there is would be another word. There is no murmur. Abdomen is soft. There is no mass or this. Lower right extremity is unremarkable. Peripheral pulse is good. Left lower extremity is significant for the dash. So left lower extremity is significant for the dash. Again, cannot fill in any word, but sometimes if the listenings are not difficult, these words you get an idea. But until now, I did not get much idea. I just got this idea that I have to fill the medical history, then I will fill the family history. Then cardiology, there is no murmur, there is no something related to ECG will happen. And that left lower extremity is significant for dash, this which is nearly healed. Both on dash. So they must be talking about both on legs, maybe something like that. So again, I will try to fill that word. This, mm, yeah, both on dash, hypergranulation. So both on legs, something like that. Let's see what will come. One small area, right, essentially within the graph side, there is a dash. One small area dash, there is an external fixation. So I don't know, there are some words which could have fit in, but this seems like a typical listening. I am unable to fit in much words, but I can understand they are talking about the grafting procedure now. Several multiple areas of hypergranulation on the left associated with the dash. Series of treatment with dash of these areas, these are closed. So again, there is not much in this listening that I can expect already. But at least I understand the patient that come after the hypergranulation and has a grafting side. Let's see what it says and we will try to fill the blanks. Okay.
Your thigh. It is almost healed right in the gluteus.
Okay.
Hello, doctor. Good morning.
Good morning. What's your problem?
Well, last year I had a traumatic injury to my left posterior. I got hit from a boat while I was in the water. I immediately rushed to the hospital where I had to undergo surgery. I'm still having an external fixation on the wound for healing fractures in the leg. I had undergone grafting and full thickness skin grafting.
Still having an external fixation. That was the word he spoke. I will make it again.
I'm still having an external fixation on
External fixation.
wound for healing fractures in the leg.
Wound for healing fractures in the leg. As said in the last video, in the final exam, now OET 2.0 is there. You just have to fill in 3 words. But earlier we had to fill so many words. But if I talk about this blank, external fixation is the main thing that you should fill according to 2.0. But yeah, he has spoken about external fixation of the wound or something like that, which I will repeat for you.
I got hit from a boat while I was in the water. I immediately rushed to the hospital where I had to undergo surgery. I'm still having an external fixation on the wound for healing fractures in the
external fixation For healing wound. Now he's talking about the purpose of the external fixation. That external fixation for healing wound on the fracture side. But again, we just have to write external fixation.
I had undergone grafting and full thickness skin grafting, close to deep.
Skin grafting is the word he is speaking. So skin grafting, only two words. It's according to 2.0. This word is perfectly fit. And again, always notice the words which are around the blank. Like in this case, thickness and close. These are the two blanks you should notice, and then you can easily do it. If you can listen to it again, just for a second.
In my post
Okay.
surgery. I'm still having an external fixation on the wound for healing fractures in the leg. I had undergone grafting and full thickness skin grafting, close to defects in my posterior thigh.
All good.
It is almost healed right in the gluteal fold on the left area. In several areas along the graft site and low in the leg, there are several
Now
tissue.
you pay total attention to these two blanks. So always pay attention to next blank. So now I have to write past medical history and medication Cipro and Dex.
Developed.
Is there any bleeding from the wound?
No, doctor.
Okay, what's your age?
So we were also talking about the spelling. External fixation spelling cannot be wrong. Grafting site cannot be wrong. Whatever the word was, you cannot do those spellings wrong. Only the brand names of the medications or the disease name on some person like Alzheimer's disease, Addison disease, these can be wrong, or augmentin and all those spellings can be wrong. Salt name cannot be wrong. Paracetamol spellings cannot be wrong because they are the salt names. Okay, so in the same way, let's go to this past medical history.
Me too, doctor.
Do you drink or smoke?
No, doctor.
Had any other illnesses in the past?
Nothing other than Clostridium difficile in the recent past.
Now this Clostridium difficile, this spelling can be wrong. And in today's modern speaking, these kind of big words do not come. Trust me, you will not find such a heavy word. So don't worry about the spelling. Just write whatever you can listen to. So Clostridium something. Let's listen to it once again.
The past?
Nothing other than Clostridium difficile in the recent past.
Clostridium difficile, whatever he is speaking. So suppose if I write Clostridium, Chlostridum. The second word was just
The illnesses in the past?
Nothing other than Clostridium difficile in the recent past.
difficile. If I write DIFICILI, then also it will go right. So you don't have to worry. But as I was saying, if it would have been a normal listening, you would have judged from here that if he is having some antibiotic, there must be some kind of infection thing. So that is what I was telling you at that point of time. Let's listen to it again.
The past?
Nothing other than Clostridium difficile in the recent past.
Are you taking any medication?
I'm taking Cipro and Flagyl.
And flagell. So if I have to tell you the spelling of the flagell, it should be FLAGYL. Again, it seems like a brand name, so spelling can be wrong. You can say FLAGYL, FLAGIL. You can do that. You will get full marks regarding this. So you don't have to worry about these small things when it comes to the brand name of the drugs. Like Cipro is also a brand name. So let's go ahead with the family history. Maternal mother had dash. Let's see.
Are you allergic to any medicine?
No, doctor.
Any illness history of family members?
My maternal grandmother had pancreatic cancer.
Had pancreatic cancer, so was damn easy. This spelling cannot be wrong. PANCREATIC, cancer, CNCR. Cannot be wrong. You have to mention these spellings nicely.
Father had prostate cancer, and he has heart disease and diabetes.
And now you should start paying attention to this. There is no dash. So as soon as he will speak the word cardiology, focus on this word.
Well, your physical examination results are perfectly okay. Cardiology reports are regular. There is no S3, S4, or gallop. There is no...
So she is saying there is no S3, S4, or one thing which I could not hear, or maybe I missed it. So I will listen it again. But even if you write S3, S4, again, I'm saying now OET 2.0 maximum 3 words can come. So you don't have to worry too much. These kind of listenings do not come in the modern days.
Abdomen is soft. Its
Sorry.
results are perfectly okay. Cardiology reports are regular. There is no S3, S4 or gallop. There is no
Or Wallop, I don't know what is that. So I will try to write whatever I can get, but S3 and S4 is noticeable. Let's go ahead.
murmur. Abdomen is soft. It is non-tender. There is no mass or organomegaly. Your right lower extremity is unremarkable. Peripheral pulse is good. Your left lower extremity is significant for the split thickness skin graft closure of a large defect in the posterior thigh.
Now again, these kind of blanks I understand. When you are preparing for OET exam, you feel like, oh my god, what will I do in the final exam? But trust me, on maximum 2 or 3 words you have to fill. So if you will listen to the 2 words, they were quite audible. I will make you listen again.
Which is for the split thickness skin graft closure of a large extremity is unremarkable. Peripheral pulse is good. Your left lower extremity is significant for the split thickness skin graft closure of a large
Split thickness skin graft exposure. That's it. Okay.
defect in the posterior thigh, which is nearly healed. Hypergranulation tissue both on your gluteal folds on the left side. There is
Both on the gluteal folds on the left side.
one small area right essentially within the graft site, and there is one small area down lower on the calf area. There's an external fixation on that comes out laterally on your left thigh. The pin sites look clean. There are several multiple areas of hypergranulation tissue on the left posterior leg associated with a sense of trauma to your right posterior leg. I would recommend series of treatment with chemical cauterization of these areas till these are closed.
Okay. So Ash ma'am, you were having some problem with this listening, but
Which
you
is
were genuinely right on your part that there were too many blanks to be filled in the final exam. Obviously, you will not have to write more than 3 words. But otherwise, if I tell you, obviously, I'm just listening. I'm not writing at the moment, so I can understand your pain that you are writing at the same time. You have to write it neatly, and at the same time, you have to take care of the spellings. So you must be feeling bad. But in the final exam, nothing like this would happen. Maximum 3, and obviously, spelling mistakes should be taken care of. And all those things are important, which I have told you over the video. I hope you have. I'm not saying you have learned too much, because I was just listening to what kind of listening was this. But rest of the last of the blanks were pretty easy. But I don't know when you will write. Maybe if I would write, then I will realize that it is way too fast. By the time you are writing one, the other one is gone. So I can understand that. But in the final exam, nothing like this will come. That is certain. Anything that you would like to say or would like to add on? I'm just unmuting you guys so that you can add on to anything, whatever questions you have. Any questions, please?
No, sir.
Any other person?
Excuse me, sir.
Yes, please.
सर जो आंसर्स है ना 13 से स्टार्ट होते हैं
Okay.
उसमें वो कॉलीज लिखा है वो रेनिटेड के बाद शी इज सेइंग कॉलीज तो मैंने स्पेलिंग CHOLICE लिखा जो मुझे सुना पर लिखे वहां पे CALIC है तो मेरा गलत है
Ma'am, what is the spelling? Is it the spelling of something, some brand name or something? What exactly it is?
नहीं इट इज मेडिसिन वो बोल रहे लिजनोप्रोल मेटोप्रोल रेनिटेड
Then I have already told you. If it is the salt name, you have to be careful about the spelling. If it is a brand name, then you don't have to worry. So you are asking about blank, which blank?
17
17. Let's listen to question number 17. They are, ma'am, they most rented in, I think it's a brand name itself, but few of them is, no, it's all brand names. So in this spelling can be wrong, ma'am. There is no worry. Amlodipine, I don't think so is a brand name. Let's listen to whatever the word it is for your confirmation. So I'm just going to play around there. Let's see.
Morning, doctor.
Good morning.
Clonidine, furosemide,
Yeah.
potassium chloride,
Just a second.
17. Chronic intermittent bipedal edema. venous insufficiency, chronic recurrent stasis ulcers,
What medications are you taking?
trimaxin, daptomycin,
Daptomycin. In this, again, spellings can be wrong, but I think DEPTOCIN, MYCIN, daptomycin, but spellings can be wrong in this because he's talking about the brand name and you don't have to worry. And let's go further.
furosemide,
And now again, when it comes to final exam these days, they will miss word like this, potassium chloride. So they will try not to have a difficult spelling. So OET 2.0 is well sorted. This seems like an old listening. That's why it is happening. Again, listen. Let's listen to 17th as well.
potassium chloride, lisinopril, metoprolol, ranitidine, cholase, amlodipine.
Coles means if I have to write, I will write CHOLES, something like that. So what's the spelling given over there?
COLACE.
See, but again, in this, there would be no deduction of marks. I guarantee you, you don't have to worry about these things.
Okay.
Any other question, please? Means there can be no deduction of marks when these are the spellings of such kind of brand names. You don't have to worry. Any other question, please, related to listening? Okay. So I will repeat because this lecture was just due to the interruption of the electricity and that too on the top of my health that is troubling me these days as well. But yeah, techniques, first of all, try to understand what the topic is. Like in this, patient was having hypergranulation. He had a traumatic injury earlier because he was hit by a boat while he was in the water. Then he was still um, having an whatever the blank was, and then they were talking about history, family history, and then they talked about medications, then they talk about his reports, investigations. But listening was not difficult in that way, but obviously the blanks were bigger. In the final exam, you just have to fill 3 words. That's it. These are the rules of the listening. Spellings have to be taken care of. Like whatever spelling in these blanks were there, you have to be careful about each and every spelling. Except only this spelling can be wrong. That is flagell, whatever he said, FLAGYL or FLAGIL, you will get the marks because that was the brand name. So you will get marks. Otherwise, rest all the spellings were important. And two or three words maximum you can write in the final exam. That would be told to you. And that's pretty much it. Any other questions from listening itself, guys? Any question from the listening party? If you want me to do what if the answer is more than that is what I'm saying. What if the answer is more than 3 words? Aman, that is exactly what we are discussing. In the final exam, it cannot come because according to OET 2.0, you are not supposed to write more than 2 words or 3 words. Sorry, 3 words or a number.
Sir, this listening is too difficult
Which
as compared to YouTube listenings.
which one? This one,
Yes, sir, this one.
1 to 12 or 13 to 24.
So 1 to 12.
Ramandeep, this is not difficult. It's just I'm having bit of struggling with my health. Otherwise, this listening was not difficult. If you want me to do in front of you, I will do it again. Let's do it. And I will take just, I hope the cough doesn't come again. I'm having recurrent cough, but I will try and do it in a flow with you guys. Let's see how tough it is. Because sometimes toughness, we start believing it. This listening was not tough because all the words were audible. I call a listening tough when the words are not audible. Let's listen to it again one more time. Do you want to listen to it again, guys? Just one more time.
So in this
No,
listening,
sir.
No, sir.
It's fine.
Excuse me, sir.
No, sir.
No, done. Perfect. So,
No,
Ramandeep, rest of the
sir, it's easy, sir.
it's easy. Ramandeep, ma'am, rest of the people feel it is easy.
Sir,
It's
you are
I
advising
think it
me to
was
listen to
fast.
it.
the
That's
problem
the
is
only
only with
problem.
the words.
sorry. Sorry.
So
Come.
the
I
listening
think it
is
was
very
fast.
easy.
Yeah, it was fast. But again,
That's the
in
only.
the examination also, we have to prepare it for the fast only, buddy. I know it will not be that fast in the final exam, but we should prepare for the worst. And if the exam will come easy, we will feel good about it. So preparing for a fast listening is not a bad idea. You can listen to it 2 times to make yourself better. That's the point. So rather than, obviously, I understand it's fast, but please don't say it in a negative way. Try to learn from it. That is what human endeavor should be. Human effort should be to learn. So try your
Over,
best. Okay, next.
overall, so it was okay.
Yeah.
Like they were saying each and everything very clear, but that I was just worried about the words that we have not that much time that we can write the first answer as that much long, and after that second one we skipped. So this was the main, like, I want to clear.
I totally agree, Arsh. But suppose if you do this listening 2 times,
Yes, sir.
in the second time you are able to cover everything.
Yes, sir.
It's not a bad idea to practice.
Yes, sir.
What is the point? That we are here to pass. We are here to learn from every listening we do. If there is a listening which is very fast, now I can be two kind of humans. One, I will say, this kind of listening will not come. Second, I can be a very dedicated candidate. I have to pass. I will prepare for the worst. I will try to do it again. In the second time, if I can fill all the blanks, I would be happy about it. So choice is yours. I am a second kind of a person. You have seen me coughing right now. I'm trying. The electricity went off. I am trying. It's about trying.
Yes, sir.
Once you keep trying,
Excuse me,
you
sir.
do your best. Yes, please, ma'am.
Sir, few days ago you tell me that practice every listening 3 times. Now this listening appears very easy because I follow you 3 times. I listen, then on the first time I score 31.
Thank you so much, Sania, ma'am. That's what I am saying. That people sometimes are mistaken when I tell them do one listening 3 times. They think that in the final exam we will have one chance. What is the benefit? It's not like that, guys. You will have the benefit. Do one listening 3 times. Like Sania ma'am is saying that I followed your advice. I did one listening 3 times. What happened is that now I am getting 30 marks in the first time only. That is what you are saying, Sania ma'am. Am I right?
Yes, sir.
See, and see, if I'm talking to Sania ma'am is talking to me, you can understand that her listening is also good, my listening is also good. She wanted to tell me something and I could understand her in one shot. So that is my practice about listening to English. So whatever she said, I could grab it in one sentence that in the first attempt only, she got 30 now. So when you do it listening again and again, you become powerful. That is what we discuss. Any other points that you would like to say on listening? Anything, buddies? Nothing? Any other
No, sir.
that you would like to cover? Any other listening, any other patient that you would like to cover? You can tell me. Again, YouTube is full of listening. Yeah, it's not about doing this or that. I recommend every person. Everybody is good. You tell me any patient. Race hands, you were saying. Race hands, OET listening, do you want to do, guys?
Yes, sir.
Yes, sir.
Okay. So which part would you like to cover? A, B, C, D. Which part?
He was also
The
fearful
C.
about taking
C.
Ben's
Part from 31 to 36 or 37 to 42. Choice is yours.
So just
31 to
minimum
36.
part.
31 to 36. Let's start then. Again, first rule, and please keep your mics on mute. I'm gonna take it that way. Okay. Why does Dr. Robson regard changes as a Shagas as a neglected disease? My question is only why. First of all, understand what is the question. Why? Shagas is a neglected disease. Why would there be a disease which would be neglected generally? What kind of disease are normally neglected? Generally asking.
So acne sometimes.
Ethnic. Ethnic means that it is happening in a particular region and other people do not care about it. So you can say when the disease is happening to minority, we don't care about a disease. Or maybe when it is having mild symptoms. So means my brain starts working what kind of answer could be. But first of all, read only the questions, try to understand the topic. You get 90 seconds. Read only the topic. Underline why it is a neglected disease. Neglected, Shangas, why. Underline 3 important words. Dr. Robson says that concern over Shagas in the USA are the result of. So in USA, people are concerned and it is due to the result of means what is the reason? Again, this question is also why. Why Shagas is a matter of concern in USA. Dr. Robin says that concerns over Shagas in the USA are result of. Again, the question is why. So try to simplify in your mind why Shagas is a concern in US. A patient called Maristel recently word is very, very important. LY words, we do it very well. A patient called Maristel recently asked Dr. Robson to test for Shagas because. So maybe there is a patient, she said, please test me for Shagas. Why? Maybe the Shagas must be spreading. Maybe Shagas must have happened to her friend. But the story, please try to make the story. So story is Shagas, why it is a neglected disease, why in US it is a matter of concern, why Maristol, a patient, went for a checkup. Okay, what are the next question? What problem does Dr. Robin identify in the case of a patient called Jennifer? So Jennifer, what was the problem? What does Dr. Robson say about his patient called Yuan? So now there are three patients. Maristol, this Jennifer and Yuan. So at least I can figure out question number 33, 34, 35 means I will not miss out. If the listening is talking about Jennifer, that means this question is gone. You have to notice every point. Sometimes listening will be fast. You might not be able to do 33rd question, but you don't want to miss out 34th because it will go in a flow, C part. So then you have to be prepared. Jennifer, Yuan, and then Dr. Robson's thinks that the short-term priority in the fight against Shagas. So short-term priority in the fight against Shagas. So my topic today is Shagas. So now I understand the topic Shagas. Neglected disease, concern in US, keywords. Then this person Maristol, why did she go for the test? Then this Jennifer, then Yuan, and then the short-term priority in the fight. Shagas is 2. Again, like a typical listening, I am expecting 3 questions to be difficult, 3 questions to be very easy. My target is 4 out of 6 if I want to pass in listening. 3 questions easy, 3 questions difficult. 3 easy, I want right, so I don't want to overthink. If I have to do 3 questions right, I don't want to overthink. And out of 3 difficult questions, I want to get at least 1 right to get 4 out of 6. Let's see how it goes. And you are saying it is a difficult listening, so I'm expecting 4 difficult questions. Let's see how it is. Okay, let's see how it is. So by the time you will read questions, they will start playing. And by the time before they are about to start play, try to read the first question complete with the options as well. So why does Dr. Robson regard Shagas as a neglected disease? Because of the social group, that it happens to a small group. It happens to only a social group. Because patients often do not realize they are affected, means minor symptoms. That is what I was saying, mild symptoms. They do not realize that they are infected. That means the disease is having mild symptoms. Because its impact is severe in a relatively small number of cases. That means it is happening to minority. So A and C is talking mainly about the minority. In A, social groups is the main thing. In C, number is the main thing. And in B, that there are mild symptoms. So that is how you simplify in that small time. That question number 1, what is the reason? Social group, minority, or is it the mild symptoms? Let's see.
Today we're talking to Dr. Jack Robson, a cardiologist and Shagas disease specialist in the USA. Dr. Robson, what is Shagas disease and why is it referred to as a neglected disease?
Shagas is caused by a parasite.
Now there is my keyword. And always remember the next question also, because I want to teach you the technique. Always remember the next question as well. USA, why people are concerned.
Called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
70.
So now he has started speaking, and now the mind will start working because he is speaking all the keywords of the options. First is he said people don't realize that they have been bitten by the insect. So B option should not be my answer because it is incomplete according to me. Again, I will make it listen to you. Please listen to it.
As a neglected disease.
Shagas is caused by a parasite called Trypanosoma cruzi. Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase,
Now see, people often do not realize they have been bitten, not they are infected. So B option is almost wrong because it is incomplete. That is what is elimination. I keep on telling you. Now the second line he is saying, which again I will make you listen. In the initial stages, the symptoms are mild. See?
most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, which carries the parasite.
Right.
People often don't realize they've been bitten, and during the initial phase of the infection, symptoms are normally mild or absent.
Okay.
70% of those infected never develop
Now the major word I can say, now he's saying that they do not realize that they are infected. This can be answered again because now he has completed the line that patients often do not realize that they are infected. But there is one extra word, that is the initial phase. So this can be answered now because he has completed the line. This cannot be the answer because initial word he has not spoken. So now I am confused. So B option, which was 100% eliminated, now I am confused. Again, I will make you listen. He is completing the line. Please listen to it once again. Sorry, because that is what I want to teach you, that how to cover those things.
Most sufferers become infected when they're bitten by an insect, commonly known as the kissing bug, and during the initial phase of the infection,
This is the word.
symptoms are normally mild or absent.
Okay.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Shagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action.
Right, I see. And are there...
Now this question is difficult. So I was expecting 3 difficult questions, but 7 million people are infected. So you will always be able to eliminate at least one option surely. So in this case, C option is surely eliminated because its impact is severe in a relatively small number of cases. No, because they were also speaking this thing. Oh my God, he was speaking about 7 million people are infected, and in the last, they create this. So he has spoken because its impact is severe in a relatively small number of cases. I think he has not spoken. I have to listen to it again. He also spoke about this thing. Now this blank is really, I cannot eliminate, sorry, even not even one. And in the last, he talked about the community groups. Community groups means social groups. So even this can be answered, B can be answered, and C also, I'm not 100% sure that can be eliminated. So it's a tough blank. In the final exam, I will not regret over this exam. But for now, I'm teaching you, so I will try once again. Really sorry. Again, let me try again.
Disease tends to remain silent. Infection symptoms are normally mild or absent.
Okay.
70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years, but it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Shagas, but it attracts relatively little publicity or funding for research. This indifference is
This indifference means neglection. Now this should be my answer, whatever he will speak now.
It attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where...
So he's saying that it is a disease of, again, the word was mainly. LY words are very important. For mainly, he has replaced the word primarily. It is primarily a disease of marginal community groups. So he is talking about more of A option. So rather than thinking too much, I will go with A option because he is saying It is a disease of marginalized community, and primarily it affects that community. So A should be my answer. I will not overthink now. B, initial word is missing, because he was saying because people do not often realize they are infected in the initial stages, because its impact is severe in relatively a small number of cases. He said 7 million people are infected and they develop chronic disease later on. So that means that it does not affect small number of cases. There are a lot of number of cases, that is 7 million. So C is not my answer as per me. Patient do not realize that they are infected. Initial phase was the extra word that he spoke, and then he spoke primarily and everything. So I think A should be my answer. So before I go to second question, I would like to know about question number 31st. If the answer is A, I will have more confidence to go to 32. But when you are doing listening, please do not overthink. Just carry on with the flow. What's the answer of 31st?
A, sir.
Kan? So please understand, if the answer is A, I have told you everything, whatever I could. I know in the final exam, you will not get that time. But first point is to understand how to do it. So I'm telling you that he said that patients do not realize it because in the initial stages, they feel they are not infected. The symptoms are very mild. So initial word is missing. It is incomplete. So that is why elimination. Then its impact is severe in relatively small number of cases. He said 7 million people are infected and they develop chronic diseases. So even C was not my answer. Then I reached to A. I will like you to listen that last C option where he will speak word primarily. Primarily means mainly. Primary means the main factor. And because of the social groups, community. But then again, you can see the vocabulary change is happening in A option, which is right. That is why elimination is easy method. That if you can realize that initial word was not spoken, you eliminate B. Then 7 million people are affected. Then you do C out and A becomes your answer. That is how you do it. Please try to listen to it, and then we are jumping to the next question.
But it eventually enters a chronic phase characterized by serious cardiac, digestive system, and neurological disorders. About 7 million people worldwide are thought to have Shagas, but it attracts relatively little publicity or funding for research. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic.
So that was the point. It is happening because then this indifference word you should know. It is an English word. Indifference means neglection. And also he said 7 million people are having this disease. So it is happening to a lot of people. It is not happening to relatively small number of cases. Everybody okay with it before we move on, guys? First question, everybody okay?
Yes, sir.
Yes, sir.
Okay, please put your mics on mute. Let's do second question. Now my main question is, why in USA people are concerned over Shagas? Let's see. Please keep it on mute. By the time, read your options.
Need resources to force significant action.
Right, I see. And are there any concerns in the USA about Shagas?
Yes, the insect carrying the parasite is
Now see, by the time they are speaking, I have read 3 options. I cannot read all the 3 things, but I have pinpointed my main noun. Nouns means the main thing. Rise in number of people at risk of being infected. That means infected people have risen. That the number of infected people have risen first. Second, greater awareness of how many people. So awareness in the first option, it was the number of people. Second option is the awareness, knowledge. Third option is the insect, increased prevalence of insect. So is it the people who are increasing? Is it the insects who are increasing, or is it the awareness? So now I have only 3 words. So the blank, which was really the options which were really huge, now it is just 3 words for me: awareness, people, or insects. Let's see.
endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Shagas. around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the benefit of our listeners, can you describe an individual case?
Well, this year, a
This blank
Bolivian
was-
woman,
sorry.
let's call...
This blank was really fast, sorry. But I want to
Any
correct.
concerns in the USA about Shagas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states.
Hmm.
Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers...
Alarming thing should be my word. If the question is about concerns, alarming thing should be my word. So answer should be in this line. Always try to find your keyword. So this is my keyword and I'm playing it now again. Alarming thing is...
Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Shagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the benefit of our listeners,
Okay. Now, question number 32nd. I will ask you some questions. You have listened, I have listened. I will ask you some questions, then we will do this answer. Did they talk about insect? That there is a prevalence of insect? Generally asking. No? So C option we think we all should eliminate.
Yes, sir.
Yes, sir.
Okay, everyone. Everybody's okay.
Yes.
C is not the answer. Don't tell me the answer, but I hope C is not the answer, right? Don't tell me the answer. C should not be the answer as far as I think.
Yes, sir.
Mia ma'am, you have to be careful about your... So C is not the answer, right, guys?
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
Now we all agree. So in the final paper, these things, again, elimination, I'm telling you. This is the way of winning OET. Whether it is reading or listening, I don't want to do all the questions for you. Just want to change your method of thinking. So this is what exactly it is, and that is what takes time. C is not the answer because they were not talking about insect. How many people were there who were affected? How many people were having disease?
7,000.
No, 7 million was in the... Now, he said only 30 people.
30 people.
Only
30 people.
So what is blank C saying? A greater awareness of how many people there have the disease. I think they were not talking about the awareness, and also the people who have the disease are only 30.
But they say in 1937, 30 people only have this disease.
Okay. So now how many people are having disease?
Rise in the number.
Okay, let's see. Okay, let's listen to it again. For clarifying this thing, let's see.
No more than 30 people have been bitten and infected while in the USA.
No more than 30 people. Not even 30 people have been infected in the USA. Not even 30 people.
Alarming thing, though, is that it's become
Alarming thing, though, is, now I will tell you,
that large numbers of first-generation and some second-generation immigrants from Latin America carry Shagas. Around
now the problem is that people carry the disease and they can transfer it congenitively. So now the thing is that it is making more people at risk. That is what I think should be the answer. He will speak it.
300,000.
right.
These people won't that large numbers of first-generation and some second-generation immigrants from Latin America carry Shagas. Around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the benefit of our...
So I think B or A, I'm confused, but A should be a better answer as per me. Because he's thinking that more people can be at the risk. But again, not sure. Nothing can be sure in the final exam. But again, A, maximum B, but A should be my answer if I am sitting in the exam. So was the answer given anyhow of 32nd? A or B?
B, sir.
B, sir.
But I don't think they are talking of... So this would be a tough question for me in the final exam. Awareness, I don't think so. They are talking about
Is
awareness.
that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the benefit,
I think even I would have been there. 30-second, I would have done A. I hope you would have done A or B according to your choice, but C is not my answer for sure. A or B, I might get confused, but according to me, A should be answer. But it can be wrong as well. That's fine. I'm not pointing out. But again, I want 3 difficult questions, 1 right. 31st, I did right. 32nd, I did wrong. Let's go further. Not to
our
overthink.
listeners, can you describe an individual case?
Now I will go to question number 33rd. Again, my main word, Maristel. Recently, why did she test for Shagas? That was the question.
Well,
By the time he will be speaking, by the time he will just introduce the patient, I will read the options. Let's see.
this year, a Bolivian woman, let's call her Marisol, asked me if she could be tested for Chagas. She's a long-term U.S. resident, but she'd recently been on vacation in Bolivia, and at one point she had felt unwell. This often occurs with changes in diet and living conditions, and that's what Marisol assumed was the cause. She'd actually been planning to donate blood in Bolivia, but changed her mind at the last minute. Ironically, if she'd gone ahead, the screening would have detected Chagas.
I see.
Hearing from relatives that Chagas can be transmitted congenitally was what prompted Marisol to come to my clinic. She and her partner wanted to start a family, and she was scared that she might pass the parasite on.
So A should be the easy answer. 33rd, 100% A. I don't want to even do it again and again. What's the 33rd answer?
A, sir.
Damn easy question, because this is what I say. 3 questions would be this way. Damn easy. You don't have to overthink. 31st difficult, but not that difficult. 32nd little difficult means was a heavy question. A or B, anyhow, if it is wrong. But try to find 4 questions. That is what I started. That is what I said in the start. 33rd, easiest question. Mary stole because she didn't want to pass on. She was thinking about a family. Simple. So she was worried that the health of any children she might give birth to. So she was worried that it can pass on congenitally, and that is what she is worried about, that she can pass on this virus to next. So easy question. So this should not be a problem at all. 33rd easiest, but my score is 2 out of 3. That is how you will assume in the exam would go. Now next question is about Jennifer. By the time I will start reading Jennifer, by the time he will speak. Let's see.
Then showed she did indeed have intermediate stage Chagas.
And what issues can arise in treating Chagas?
Well, another patient, I'll call her Jennifer, felt unwell following a vacation in a region where Chagas is endemic.
By the time he had just spoken 1 line, this is where your energy has to be. I have read 3 options. First option, that she was not accepting it. First option, she was not accepting, she was rejecting. Second option, medicine, that she was having problem with the medicine. First thing, she did not accept the diagnosis. Second thing, she did not like the medications. Third thing, that there was a delay between the initial infection and the treatment. So these can be the, so now we have to talk about what problem did she identify. Let's see.
Tests indicated she was Chagas positive. Jennifer was then referred to my clinic where we do further tests. Meanwhile, she looked up Chagas online and understandably was distressed by what she read. Why me? She once said to me. She was also fearful about taking benzonidazole, the main drug used for Chagas, because it has potentially harmful side effects. For optimum impact, it should be taken in the first 2 months of the disease, but by the time the testing had been completed, 10 weeks had passed since the likely date of the bite. For information, Jennifer took benzonidazole and didn't react badly to it.
And do you deal with patients?
So answer should be C. Answer should be C. 34th answer. 34th answer, guys.
C, sir.
Right? Now I will tell you why. When the infection happened, she read everything online. And she understood the disease. And she asked, why me? So she's just saying, why me? Means she's upset about it. So it is a shocking news for her. So it doesn't mean that she is unwilling to accept. She's saying, just like we say, oh, why me? If something. So I'm shocked. It's not like I'm not accepting. She has accepted the disease. She has accepted the disease. That's why she went online and searched. A was not my answer. Last line when he said that thankfully she reacted to the medication well. Reacted to the medication well, that means she tolerated the medication well. So even B cannot be my answer. So my method is elimination. And that is what I wanted. It makes my journey easy. Again, you will listen to both the words very easily. 33rd easy, 34th easy. Again, I will make you listen. Let's see. Yeah.
Was distressed by what she read. Why me? She once said to me.
So she was distressed, means she was not happy. She was disappointed. But that doesn't mean that she did not accept it. She was distressed. Then
He was also fearful about taking benzonidazole, the main drug used for Shagas,
she was
because
fearful. She was fearful. So then I thought B might be the answer. At this stage, B was my answer. But that is what elimination is all about. Then you keep on listening.
has potentially harmful side effects. For optimum impact, it should be taken in the first 2 months of the
So now
disease.
he is talking generally about the medication, that it has some side effects.
But by the time the testing had been completed, 10 weeks had passed since the likely date of the bite.
Since the likely date of the bite means since the initial infection, 10 weeks had passed. 10 weeks had passed.
Patient Jennifer took benzonidazole and didn't react badly to it.
And
Now this last line saved me. He said she did not react badly to it. That means she tolerated the medication well. So B should not be my answer in that case. That is how I reached to C. I could have never reached to C if I did not use elimination. If I do not use elimination, this is also a tough question. But if you understand 31st and 34th question are right due to my elimination method, which I say again easy, because patients do not realize initially word was missing. That is what I'm teaching you in reading. Rest of the words will match. One word will not match. Initially word was missing. 7 lakh people were infected. 7 million people. 7 million means 70 lakhs. So it is not relatively small number. So that is how I eliminated these two. And then it said primarily infected, marginally, community marginalized. So I realized A is my answer. In the same way, this from the initial bite until now, I understood that it was 10 weeks. That means there was a delay. So again, indirect. But how do I reach direct? By elimination. That she did not react badly to the medication. That means she tolerated the medication. So then I have to take the risk. I went 34th C. So you can again confirm me whether it is right. Again, it's about practice. You can never be sure. So 34th, 100% C.
Yes, sir.
All right. So did you understand this question? Did you learn 31st? Did you learn 33rd, 34th?
Yes, sir.
Yes,
Yes,
sir.
sir.
33rd was the easiest, direct question. Don't overthink in these kind of questions when simple thing is coming. Now I am expecting that 3 difficult questions are over, 31, 32 and 34. These 2 should be easy. 3 easy, 3 difficult. These 2 should be definitely easy as per me. Let's see.
with patients in later stages of the illness?
Yes, I have a 62-year-old patient called Juan. 8 years ago, he was diagnosed with dilated cardiomyopathy, and Shagas was also detected in him.
Now, by the time he has just spoken one line, you read your options by them. I have read 3 options, especially last 2. Incorrect diagnosis in the start. Second, medication was ineffective. 2 I could understand. Third one is little difficult, that his illness was typical of the people with Shagas. Means typical word here, I cannot understand whether it is similar or different. So that is why I'm confused. The development of illness was typical of people with Shagas. Over here, it is appearing as similar, but I'm not sure. But at least I understand 2 options. So that is where I feel lucky. Incorrect initial diagnosis, condition worsened, or medication ineffective. Let's see.
Tested for Shagas earlier in his life, his long-term prospects would have been better. A year after the diagnosis, Juan was found to have...
Sorry.
Years ago, he was diagnosed with dilated cardiomyopathy, and Shagas was also detected in him. If he'd been tested for Shagas earlier in his life, his long-term prospects would have been better. A year after the diagnosis, Juan was found to have type 2 diabetes. This was dealt with relatively well, though his body did initially reject insulin. Juan took drugs for his heart and for several years was reasonably stable, but eventually monitoring revealed severe cardiac deterioration. His experience is very much what you'd expect in someone who's had the disease for years, and it's reached the latter stages. There's no cure, and the main recommendations are rest, exercise, and appropriate diet.
I see. And what can be done to combat Shagas?
Sorry, was fast.
Was found to have type 2 diabetes. This was dealt
If
with
by chance, if I do not get a second chance, even then I'm confused. I want to listen to it again so that I can teach you how to do it. Let's find out the words. It again was not that easy, but let's try and find the words.
The stages of the illness.
Yes, I have a 62-year-old patient called Juan. 8 years ago, he was diagnosed with dilated cardiomyopathy, and Shagas was also detected in him. If he'd been tested for Shagas earlier in his life, his long-term prospects would have been better. A year after.
B should not be my answer, as per me until now, because there is no incorrect initial diagnosis. He said that he was diagnosed with this as well. So the diagnosis was correct. He's just generally saying if he would have been diagnosed earlier, but there was no incorrect initial diagnosis. That's what I think until now. There is nothing like incorrect initial diagnosis. Initial diagnosis was not there. That was the problem, but it was not incorrect. Let's listen to it again.
Cardiomyopathy, and Shagas was also detected in him. If he'd been tested for Shagas earlier in his life, his long-term prospects would have been better.
So, but there was no incorrect initial diagnosis. That's what I feel. Let's see.
A year after the diagnosis, Juan was found to have type 2 diabetes. This was dealt with relatively well, though his body did initially reject insulin. Juan took drugs for his heart and for several years was reasonably stable, but eventually monitoring revealed severe cardiac deterioration. His experience is very much what you'd expect in someone who's had the disease.
His experience is very much you will expect something in the person having Shagas. Let's listen to this line again.
Was reasonably stable, but eventually monitoring revealed severe cardiac deterioration. His experience is very much what you'd expect in someone who's had the disease for years, and it's reached the latter stages. There's no cure, and the main recommendations are rest, exercise, and appropriate diet.
So again, not to overthink, I would like to do A, but C can be the answer as well, but can't help it. I don't want to overthink. What's the answer, 35th?
A, sir.
So again, as per the said terms, 31st, little difficult, 32nd, very difficult, 33rd, very easy, 34th, all right, 35th, very easy. Again, because straight line was there, his experience was pretty much similar to as the people will have. So that it is typical means similar of the people with Shagas. And the medication he took was largely ineffective, was little confusing. He said something about the diabetic medications.
तो सर उसने बोला था इनिशियली वो इंसुलिन एक्सेप्ट नहीं कर पाई पर बाद में कर पाया वो इंसुलिन एक्सेप्ट
Again
यही बोल रहा था.
It confuses you, Sania ma'am, in the end at the end of the day. But this question is much easier because it is straight away given.
Yes.
Like, there is no elimination method. Now, in 33rd, we did not require elimination. In 35th, also, no elimination is required. That is what I am saying. Easy questions, don't overthink. Difficult questions, elimination will work according to the difficulty of the question. So again, in this also, I did not use elimination too much. I was focused on this, was typical, was similar. Let's see 36th. By the time he will start speaking, now I know this. By the time he's speaking, now I'm reading 36th.
Hey, and what can be done to combat Shagas generally?
Plenty.
Combat words, C-O-M-B-A-T. Combat means fight. Combat. Combat. C-O-M-B-A-T. Combat. Fight. So, short-term priority in the fight against Shagas is to
Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes.
Now I have read the option. That is how fast you should be. I do not understand everything about the options, but main things. First, kill the insects. Second, produce medication for children. Children word should also be there. Otherwise, elimination. In the second blank, children word is very important. Produce medication in a form that is suitable for children. Only for children. That means if they talk about adults, this option is also eliminated. It means destroy the insects, kill the insects, produce medication, or design and manufacture a vaccine. Also, there is a difference between medication and vaccine. Means three important keywords: insects, kill the insects, vaccine, or medication for children. 3 words, that's it.
At least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults.
Sorry.
Exists, but it takes at least 10 years
Don't forget the question short-term priority. What is the short-term priority?
None to combat Shagas generally.
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug.
10 years to supply a new drug. That means C is not my answer. You cannot design and manufacture a vaccine in short-term priority. Please understand elimination. You cannot design on it. Takes at least 10 years. Let's listen to it again.
None currently exists.
My question is short-term priority. Never miss out the question. Question is the key. This much too you have to become strong. We are almost at the end of the listening. Last question.
But it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Shagas to humans, but initiatives like those take decades rather than years.
Well, Dr.
So A is not my answer, C is not my answer, only B is my answer. Right? B is the answer, right?
Yes, sir.
Yes, sir.
Yes, sir.
So again, listening is pretty much balanced. 35th, 33rd, 36th, easy. 3 questions I know. So don't call these listenings difficult. Just try to fetch 3 marks, which are short and easy. Try to get 1 out of 3. If you can get 2 out of 3 like me, then too you will get 450. You're going to get like 4 out of 6, you will pass. That's the point. Do you all understand, guys? Any doubt, anything that you would like to say or ask in this? 32nd question is wrong, that's okay. If I am getting 5 out of 6 in one part, I am okay to move on. Then I can move on. If I'm getting 4 out of 6, then to improve myself, I will try to get 1 more out of the 2 I have missed. 5 out of 6, that means you can move on to next listening, no problem. 6 out of 6 is best, but at least to move to next listening, make a target 5 out of 6. Then you will become best. Don't do listening 2 times, 3 times, 4 times. Count your marks. 5 out of 6, you can move on to the next listening. Otherwise, don't move. You will become ultimate. Any doubt in this? Any questions regarding especially 33rd, 35th, 36th, and then from 34th or 31st? Any question? Please. Happy to answer. No questions, please. Any questions before we leave? No? Sharon?
No, sir. I
I-
love your strategies and it helped me a lot.
It's just about, see, again, there are small things which will happen, Sharon. It's not going to work in single go. That's great if you are believing me, but keep believing, understand the tactics. That sometimes when there are difficult questions, go for elimination. Okay?
Yes, sir.
Okay.
Yes, sir. I'm doing it. and it's working very well.
Great.
Thank you.
Rest will see you guys tomorrow. Take care. Bye bye.
Okay, sir. Take care. Have a speedy recovery as well.
Trying my best. Again to say, see, still I curved pretty less in the last 45. That is what hard work does. It takes you away from bigger problems. Just keep focused at small problems. Keep following the procedure. Keep doing the best you can, what you have in your hands with, and you will see your improvement happening right in front of you. This is Dr. Bhupesh from Dr. BK Moit Institutes. Keep listening these lectures again and again. If you get tired, if you get bored, you don't want to do anything new, then you have my lectures. Just listen to it. Don't do anything. You still can pass with my lectures. I guarantee. It's just about following them. Thank you very much.
I believe.
We'll see you
Thank you,
guys.
sir.
Thank
Thank you, sir.
Thank you,
Okay,
sir.
sir.
Yes, sir.
Goodbye.
you very
Take
much.
care.
Thank
Thank
you.
you, sir.
Thank you,
sir.
everyone. Thank you.
See you tomorrow, sir.
See you tomorrow.
Okay.
Bye bye. Take care.